Hey, what's up everyone? I hope you guys are all doing well. I know things are difficult right now with the coronavirus and everything going on around it, but today I want to share with you guys a special webinar, and this is for anyone that has some back issues right now and may be struggling, or is maybe just looking to learn a few new things about back pain that maybe you didn't know about. So the title of today's webinar is 10 back pain tips you probably don't know. So before we begin, just a quick about me. I'm a former competitive hockey player, researcher, in which I did research on stair climbing sprint interval training, a public speaker, consultant and advisor to people with back issues in relation to exercise. Most importantly, a strength and conditioning coach. So the picture on the right here is when I was working with the Toronto Raptors. Prior to that, I was working with the Windsor Spitfires. So these experiences is where I learned a lot of my training knowledge and where my background kind of originated. And I'm also the owner of Sovran Training Systems, which is my business. Now, why should you listen to me and why should you take back pain tips from me? Well, everyone's injured themselves in the gym or exercising, whether you know it or not. Nothing has shocked me yet, so I've worked with a wide range of people with different back injuries, whether it's disc herniation, annular tear, Schmorl's node, an end plate fracture, spondylolisthesis, stress fracture, you name it. And I've been able to successfully work with these people and give them exercise programs that allow them to get a training effect without producing symptoms and at the same time minimizing and reducing them symptoms and making them feel better. And I'm also a mess structurally, but it hasn't held me back from training. So this is where a lot of the back pain stuff stems from, is my own back issues. And if we look to this picture here, we have two MRI reports. The one on the left was taken January 6, 2014, and the one on the right was July 24th, 2017, about 3.5 years later. Now I want you guys to look at the one on the left right now. In the bottom left, we can look and see we have a disc protrusion that is impinging on the right S1 nerve root. And then if we look to the right MRI, we have a disc protrusion that is still approaching that right S1 nerve root or creeping up on it. Now, injury still exists, still have the disc protrusion. The difference here though is the one on the left is when I was in significant pain. I wasn't able to sit for longer than say 30 seconds. I couldn't sleep at night without taking painkillers or anti-inflammatory medication. Within about a minute or less than a minute of driving, I had significant pain. Whereas the report on the right, at this point, even though it looks very similar to the report on the left, I'm pain-free, deadlifting over 300 pounds, and life is just about normal. And I'll kind of get into the difference here and why I am on the left in a lot of pain and on the right why I'm basically pain-free as I kind of walk through this presentation with you guys today. Now, from my own back issues and everything, this led to me becoming kind of the low back pain guy, or at least why I specialize in back pain. And how it started was with my initial injury, and that occurred though when I executed a deadlift with poor technique and I threw my back out back in October, November of 2013 is when that initial injury occurred. And right after this, I kept training. I didn't know what I was doing. I was doing a lot of wrong things in the gym, and it only made my back pain and injury worse. And then eventually that led to my MRI on January 6th of 2014. And then in the initial 6-month period, I had no improvements. I worked with multiple chiropractors, physiotherapists, doctors, specialists, and at best, a few of these people provided me with temporary relief. But some of them, with their advice and exercise recommendations, actually made me worse. And it was a very difficult time because I was working with all these different clinicians and people that are supposed to be kind of the expert when it comes to overcoming these issues and treating these issues, and I was only getting worse and I had no improvements, and it was a very dark time those first 6 months. So eventually, after being very frustrated with what I went through, in April of 2014, I stumbled upon Dr. Stuart McGill, and this is when I kind of took my own rehab into my own hands and took that initiative to get better myself because no one else out there was helping me. And Dr. Stuart McGill's work, so as soon as I stumbled upon him, all of his work and his research and everything started to resonate with me. So Dr. Stuart McGill is a spine biomechanist at the University of Waterloo, and he was studying back injuries. And a lot of what we was saying about how the medical system is flawed when it comes to back pain, whether it's the assessment or the treatment, just the whole process, he was explaining and laying out how it's flawed. But he also described how a lot of the exercises and things that I was doing in the gym created a disc issue. And if you look at to the mechanism that I hurt myself on was a poorly executed deadlift, which over time, if you continue to execute a deadlift like that, eventually it's going to lead to a disc herniation. And that's eventually what happened in my case. So a lot of his work basically resonated with me, and it helped with my recovery. And then eventually in September of 2015, almost pretty much a little over about a full year later, I was able to make a pain-free recovery. And then after my pain-free recovery, eventually I posted a YouTube video. And this is my first YouTube video. So in about 3 weeks from now or so, it'll be about 5 years since I posted this video. And this was my first video. It was my story of lower back pain, L5S1 disc bulge, and top 5 recommendations. And as you can see, based on the views here, it went somewhat viral. And I took this photo a couple months ago, but we're probably close to around 400,000 views now. But when I posted this video, there was thousands of people that commented, viewed it, liked it, emailed me, messaged me, just sharing a similar story of what they went through and how it was similar to me in terms of visiting with doctors and working with different physios, chiros, and a lot of these doctors telling them with the pains in their head, they're not getting the proper treatment, they're wasting their money, they're on a lot of pain medications and just not getting better, and they're just in a very difficult position. And it was a very difficult time for a lot of these people as well. But what I found and what I realized was that this was a very underserviced area. A lot of people out there with back pain, more specifically discogenic issues, were being underserviced, and they weren't getting better, and there was something that was seriously flawed there. And I know Dr. Miguel talks a lot about it a lot, or he talks about it with a lot of his work, but that just kind of opened kind of a door in my head that, hey, this is something, that perhaps I could help a lot of people out with, just from my own experience in overcoming my own back issues. And just to share you a couple quick statistics that I want to run through quickly. May 2015 was my initial story. I've now over 350 plus YouTube videos and over 100 plus blog posts at remisovran.com, a lot of which I post about back pain and exercise. Over 1.1 million views, over 5.5 million minutes of watch time, over 7,500 plus subscribers. And it's this whole online platform that I've created has led to an additional revenue stream in the sense of online training and Google AdSense, and which I work with clients that have back issues in a consulting and training aspect online. So as you can see from some of these statistics, there's a lot of people out there that I know that I'm helping, and a lot of people out there that are just resonating with me, and that I'm able to kind of support and help them out with their own back issues. And to just share with you guys a couple testimonials with clients. Here's a testimonial from Joe, which is an in-person client of mine. Remi has improved my back health dramatically. The structured workouts have allowed me to return to a normal and healthy and productive lifestyle again. And these other two testimonials are from two online clients, both who had herniated discs, and they occurred during deadlifting. But if you're interested in seeing more of my testimonials, you can head over to my website. But just want to share with you guys some of the results that I've been able to get with some of these people. And now that leads us into the main part of this presentation, which is our 10 back pain tips that you probably don't know about. So let's start with number 1 here. Disc and ligaments are at a greater risk of injury in the early morning. So to understand this, when we go to bed at night, our discs, and when we lay down, our discs fill up with water and they expand. So that's why we are the tallest when we wake up first thing in the morning. It's because of the added hydration in the spinal discs causes us to increase in our height. And what that does, it's almost like a water balloon ready to burst. So there's an added pressure that's built up. So when we bend, the stresses are going to be much higher on our discs and also our ligaments. So to put it in perspective, If you do a sit-up first thing in the morning, the sit-up will be about 3 times more stressful on our spinal discs compared to if you did it in the afternoon or evening. Now the ligaments, on the other hand, the reason why they're at a greater risk for injury is because we're taller, we place a greater stretch on our spine and on our ligaments. So when we do bending activities, there's a greater stress there. So the important takeaway here is that one reason, people wake up with backaches in the mornings because there's an actual kind of biomechanical and physiological mechanism at play here. And the important thing is that if people have existing back issues, one recommendation that I will use with a lot of my clients is it's probably best to work out in the afternoon or evening. And you have to be very careful the first 1 to 2 hours after waking, because that's when you're at a greater risk for developing a disc injury or making it worse, or a ligament injury. Now, moving on to tip number 2. What radiology can tell us about preventing back pain? So here's a meta-analysis in which it looked at asymptomatic males and females at age 40. Now, I just took 40 just to kind of show you guys a point here and prove a point, is that they found that 50% of people, asymptomatic males and females of 40, were found to have a disc bulge, 33% found to have a disc protrusion, 18% found to have facet degeneration, maybe some osteoarthrosis, or maybe some osteophytes, 8% found to have spondylolisthesis. Now, looking at this data and what we see from this report here, you can assume that about 1 in 2 people may have a disc bulge that are maybe a male or female at age 40 and are asymptomatic. 1 in 3 may have a disc protrusion walking into the gym if they're training with me. 1 in 5 may have some sort of facet degeneration, and 1 in 10 may have spondylolisthesis. So now this is important because this is going to influence the exercise prescription and the exercises that I choose to prescribe to clients. Because if about 1 in 2 people coming to see me for, say, training have a disc bulge and they're asymptomatic, we don't want to take them from an asymptomatic point and put them into a symptomatic point by giving them the wrong exercises. So I'll explain kind of in the next slide some exercise examples, but this knowledge here that I know, it's safe for me to almost assume that, hey, I need to be very careful because a lot of these people may be coming in with issues that are maybe unknown. And if we look to tip number 3 here, sit-ups and supermans are poor exercise choices. A lot of this is thanks to Dr. McGill's work. So the sit-up itself produces about 3,300 newtons of compression on a flexed lumbar spine. Now, it's important to just remember flexed. Now, the National Institute of Occupational Safety and Health has set the limit of about 3,400 newtons of compression as kind of a safety level for, say, the average worker. And anything above that is going to put an individual at a greater risk for a back injury. Now, the sit-up is about on border with that 3,400 newtons of compression force, but it's on a flexed lumbar spine, which is important to keep in mind. And from McGill's work, we know that if you do enough sit-ups over time, you may or will create a disc herniation at some point if you do a high volume of them continuously throughout your life, and especially as you add load in. Now, Supermans, on the other hand, may produce over 4,000 newtons of compression on an extended lumbar spine, and research has even shown up to 6,000 newtons of compressive force on an extended lumbar spine. And that's where, it's almost about double the NIOSH limit there, or average there. Now, it's important because now in the Superman, we're talking about an extended spine. So when we talk about extension-based injuries, we're talking about people with facet degeneration, spondylolisthesis. So you think about if I took someone with maybe some facet degeneration, 1 in 5 people may have it, you could say, and we gave them Supermans, maybe we added some weights to them, we could maybe take that existing asymptomatic issue and make it symptomatic. And then in the case of the sit-up, same thing. If someone has a disc bulge that is asymptomatic, we give them enough sit-ups, maybe add load, maybe make it worse. And then the next thing you know, that asymptomatic disc bulge has now become symptomatic. So the exercise choices we make, we have to be very strategic and smart about how we're prescribing exercise to clients and people that we work with. And then this leads me to number 4, avoid butt wink. So here is a client of mine, a former client, Christian, and this was an initial assessment that I was doing with him. And on the left, you can see that he's engaging in butt wink. So butt wink occurs when you squat, you try to squat deep, and then the low back tilts and rounds, and you get this butt wink occurring. Now, in a bodyweight position like this, this isn't a problem if he's asymptomatic. But if he repeatedly does this, and say we put a barbell on his back and we add load, we are now creating the mechanism for a disc herniation. If he continuously repeats this, eventually a disc herniation could be created. Now the photo on the right is he squatting to a more neutral position. He's not going so deep, and he's still getting a training effect for the lower body, but he's minimizing the risk of injury there. So this is what we want with clients and in terms of preventing back issues. Now, why does butt wink occur, you may ask? Well, it's more of an anatomy issue, is what I would say and what I've learned. And Dr. Stuart McGill talks about this more, but people with a deeper hip socket are going to have a difficult time squatting deep, just because they run out of room and with the head of the femur, and what ends up happening is lumbar spine will compensate to allow them to get lower. People with shallower hip sockets will maybe be at a greater risk for a hip-related injury, but they'll be able to squat deeper because they have the range of motion through their hips to allow them to squat deep and to not put their back in a jeopardized position. So, if you're wondering ever about the anatomy, this is more of, I'd say, an anatomy-related issue, though, but something that we need to kind of flag and look for in an assessment. And now moving on to number 5, hip shift on a squat. So this is a tip I actually learned from physical therapist Alex McKechnie when I worked with the Toronto Raptors. This is something that he kind of introduced me to and showed me. So in the sport of basketball, if you ever watch a basketball player take a free throw shot, you'll often see that they will shift their hip. So the shot involves a partial squat, but it also involves a hip shift to the side to the arm that they're shooting with. And that's just part of the shooting motion. The problem is that motor pattern gets ingrained into the basketball player's head, and then when they go into the weight room, they will start squatting like that with that hip shift. Now, in a body weight position like this, probably not an issue like you see on the left, but if we put a barbell on their back and add 45-pound plates on each side, and we have them do that over a period of time, eventually that can lead to some sort of hip or back issue, perhaps an SI joint problem. So a simple cue or simple way to fix this is just to cue the person to kind of center their hips and stay square. But if it's not a motor pattern issue, it could be a mobility issue that has developed. Maybe there's a lack of hip internal rotation. We may have to do some foam rolling or mobility drills with them to kind of improve the hip range of motion a little bit, or maybe they need some manual therapy, someone to get in there really on that hip to kind of create some motion and loosen things up. So depends on the person, but this is something that we need to screen for and be aware of when it comes to the squat, is looking for a hip shift. Now, number 6, don't foam roll the low back. This is a tip I got from Dr. Stuart McGill. And so we see the skeleton here, and under the skeleton's low back, we see the foam roller. So if we look at the thoracic spine, the middle of the spine there, we have the rib cage, we have the shoulder blades that help support the thoracic spine. So if we look at the lumbar spine, though, where the roller is, we don't have that same support. So when a person lays on a foam roller and starts rolling up and down, they're applying full body weight shear stress to the low back. And if they have some back issues going on that they don't know about, or they feel a little bit of stiffness, a little bit of a tweak there, and they try to roll it out, they may only be making it worse, because they could create perhaps a painful micro movement. And I would rather have someone, if they feel something going on there, to go see a manual therapist and have them get in there with their hands specifically and precisely to adjust something. So the lumbar spine does not have the same structures as the thoracic spine to help kind of move or take away some of the forces on the lumbar spine when you kind of roll on a foam roller like that. Now, number 7, overhead pressing. So not everyone is qualified to do a barbell overhead press safely. And if we look at the photo on the left here, and the red arrow is pointing to my low back, you see this extension pattern occurring, and then on the front of my stomach there, you see my stomach kind of pouching out and my ribs are flaring up. Now, in order for me to get the barbell overhead there, I am compensating by going into this extension pattern. Now, in a body weight position, not an issue if they're asymptomatic, but if we put weight in the person's hands, like you can see a barbell in my hands, and we maybe put some plates on there, and we repeatedly do this over time, this could lead to a stress fracture. It could lead to maybe irritating some facet issues, maybe some osteoarthrosis occurring there and making them worse. And if we look at the right, we see a better, more neutral position. The spine's in a better position. We don't have that same outpouching of the stomach or rib flare-up occurring in the front. and we're getting overhead safely with the barbell and our back's in a good position. So the important takeaway here is that not everyone is qualified to overhead press, and there may be some certain limitations or restrictions preventing them from getting overhead safely. And usually this has to do with a lot of stiffness, maybe in the lats or long head of the triceps, or maybe they just have poor anterior core control. So it's just kind of teaching them to maybe brace their core a little bit more and maybe reducing some stiffness around the shoulders and upper back area. Okay, tip number 8 here. Here's a myth. Sitting on a stability ball helps spare the low back. Now, you may have seen in an article or maybe on the television where people are sitting on a stability ball and preaching that it's good for the low back, it helps strengthen the core. And unfortunately, this is just misinformation and is not true. Now, this isn't to say that sitting on a stability ball is bad or it's going to create a back issue. If we look to what researchers found in 2006, they actually compared sitting on a stability ball to a regular chair, and they found that there was no differences in terms of the core activation patterns. And they actually found that participants perceived sitting on a stability ball as uncomfortable. They didn't find it comfortable sitting on a stability ball, and they found that sitting on a chair was more comfortable to them. And this was also followed up by McGill and colleagues in a follow-up study in which they found similar results. So the thing is, when you sit on a stability ball, keep in mind, in this photo, there is a little bit of a lumbar support, but majority of the stability balls you see, there is no lumbar support. It's just a ball, and it's an unstable surface that you're sitting on. When you compare that to a chair, a regular chair, and if you have an ergonomically designed chair with a good lumbar support, that's going to beat a stability ball any day, because you have the lumbar support to help keep your lumbar spine in a better position, whereas a stability ball can't offer that same support. So, just something to be aware of and a little bit of a myth if you didn't know about. Moving on to tip number 9, exercise programming, burpees and deadlifts. So the burpee is a full body conditioning exercise, and the deadlift is one of the most technical exercises out there. It's one that people often throw their back out on. Now, I believe that pairing burpees with deadlifts is one of the worst combinations out there. Now let me explain. The burpee is a full body weight conditioning exercise, and then if you go to perform deadlifts right afterwards, which is one of the most technical exercises out there and one of the most common that people throw their back out on or hurt themselves on, is it smart to induce fatigue and then go do one of the most technical exercises out there where it really requires you to think and takes a lot of execution to perform the movement? I believe this is one of the worst pairs out there, and unfortunately you may see this in a poorly designed CrossFit scenario, and it's how people injure themselves. So the one thing that we need to be aware of as trainers and coaches, or just people in terms of the general population looking to work out, is you have to consider how you're pairing exercises. Burpees are mostly found in a conditioning scenario, and that's where they should be, is in a conditioning scenario. If you want a conditioning effect, stick with conditioning-based exercises. Don't be starting to do very technical exercises like deadlifts. Deadlifts should be more of a strength-based exercise where you're executing it for maybe lower repetitions and really focusing on the movement as opposed to just kind of banging out reps and alternating that with burpees. That is just a recipe for disaster. So the point being here is we have to think about how we program exercises and how we pair them. And then my final tip for you is just a little simple tip when it comes to coughing and sneezing. So often people will trigger their symptoms when they cough or sneeze, and they may get like a backache, or they may get a shooting pain in their back when they cough or sneeze. And the photo on the left here would demonstrate that in terms of a regular cough or sneeze. Now, one way we can alleviate symptoms and alleviate pain is we can tilt our neck upwards in an upward direction, and we can change the line of force and reduce the activation of the core musculature. And this is a tip I got from Dr. McGill's book, Back Mechanic, but it's just a little simple tip that people can implement to help spare their low back when they cough or sneeze. So that is it for my presentation today, guys. I hope you guys enjoyed this, and if you'd like to follow up with me and would like to check out more of my resources, you can head over to remisovran.com, where I run a free blog, and I have a YouTube channel where I'm posting back pain tips and exercise tips as well. If you have any specific questions, feel free to email me at askcoach@remisovran.com. And if you're interested in online coaching, you can head over to my website, remisovran.com/coaching, for more information. And if you're just interested or curious about how my online coaching process works, I'm going to put a link in the description below of a previous video I did with a former online client of mine, Denise King's story of low back pain, and it's client assessment and coaching. So Denise had some bad disc issues, and we basically took her from a point where she was experiencing a lot of pain to the point where she was back to working out and training. And in this video, I walked through the whole assessment, to the exercise programming, to the tips we implemented to get her to that point. So you can kind of see my coaching process in detail there. And then for anyone that is maybe local and is interested in something more local in person, just feel free to email me at askcoach@remisovran.com, and we could perhaps arrange something when this coronavirus, everything around it, settles down. So thank you for your time, and if you guys have any just general questions or anything, please leave them in the comments below, and I'll be happy to answer any questions that you guys have. Okay, I hope you guys enjoyed this presentation and webinar. All the best, and take care.